Hello friends, Namaskar. So today I will be talking about psychological reactions, and I believe one lesson by Dr. Geeta Joshi has been already taught to you earlier. So this is in addition to that particular lesson. I am Dr. Yashwant Joshi and I am the Vice President of NAPCAIM, that is National Association of Palliative Care for Ayush and Integrative Medicine. Psychological reactions, that is very common. Whenever something happens, some trouble comes across the life, whether you are sick or you are injured or anything, either financial problem or professional problem or anything, naturally your mind is going to react. And when mind reacts, most of the problem starts. So what sort of reaction can take place? We'll just visualize them, we'll just describe them in short, in brief, First, the fear, and you have seen the eyes in the picture, your eyes get widened. And in fact, if you look into the eyes, you can read fear into the eyes, because something drastically wrong is going to happen to me, around me or anywhere, Even if it does not happen to the person himself or herself, the fear comes in when it is going to happen to others very close to them. And it's an emotional response characterized by an expectation of harm or unpleasantness. Something dreadful is going to take place, harm, whether you are likely to get injured or somebody else is going to get injured, or some unpleasant which you really do not like, very, very unpleasant. Usually it is associated with behavior that attempts to avoid or flee a threatening situation. Patient is usually aware of the specific danger and has some understanding into the reasons for the fear. Fear comes, you generally know, it may come all of a sudden, but you come to know, you see that this is happening to you. And in such a situation, you want to get away immediately from that place. You want to flee. Bhag jana chahte aap. So that is what happens when actual danger to yourself, to your body, to your nearer one, or something you love, that is going to take place. Fear is very common indicators. Rapid heart rate, you start breathing very hard, very short breathing. Your mouth gets dry. Even if you want to shout, you want to ask for help, a voice does not come out because your mouth is dry. Constipation, hypertension, increased perspiration. Sometimes if the fear is so intense that your body starts perspiring, even your clothing gets wet. The flight or flight reaction. Now in such a fear, only two things are available to you. Now it depends upon your temperament. Either you can fight against the fear, or you just run away from the fear. And this is a very old syndrome, fight or flight. Millions of years ago, when our ancestors were living in forest, this is what they used to do whenever they used to face wild animals, and still this particular fight or flight syndrome is going on with us. Second is anxiety. It relates to uncertainty. When you say anxious, when do you become anxious? When you do not know what the result is going to be. You are eager to know, and you want to know, you are so eager that you want to know the positive result also. But again, there are chances after all. So it relates to uncertainty and fear of future or threat of separation from loved ones. Behaviors are similar to this seen with the fear, but are not usually as dramatic. Because the patient does not know its specific cause, he or she usually focuses on the physiologic symptoms of anxiety. What are the physiologic symptoms of anxiety? Fatigue. You get tired. You just can't work. Even if you work for 10 minutes, you feel that you have worked for 100 years and you want to sit down. You want to pass a lazy time. Insomnia. You can't sleep properly. You can't have a constant sleep of 2-3 hours. Otherwise, a person requires minimum 6 to 8 hours of sleep to refresh next morning. Diarrhea or constipation. You can't control your bowels. Urgency, nausea, anorexia and excessive perspiration. You see the lady here under anxiety, she just puts her both hands on her head and just thinks. She has closed her eyes because she doesn't want to visualize what is going to happen. What is going to happen to anybody in that particular situation. Physical palpitations, breathlessness, dry mouth, dysphagia, anorexia, diarrhea, dizziness, sweating, tremor, headache and muscle tension. Mental, bad sleep, frightening dreams and fear of loneliness. You feel lonely even amongst hundreds of people because you are just thinking about your anxious ideas. Third is the stress. So far we have seen two reactions, fear in utmost danger situation and lesser than that comes is the anxiety and third is the stress. It is a state of strain or tension, again psychological, mainly occurs in situations which require an increased and often prolonged effort to adjust. Any factor that disturbs the physical, psychological or physiological homeostasis of the body may be stressful. Stress can occur even in normal circumstances, children also, and that is what happens in normal families. You want your son who has just passed with very good marks in standard 12th exam and you want him to join some IIT or something, some engineering or medical college, but he does not want to be a doctor or an engineer. And then finally by hook and crook you just put him, you pressurize him, you coerce him to join engineering college which he does not like. So, that is where such a brilliant boy comes under stress. We do not know whether he is going to complete that particular course of engineering or not. So, stress is not only with the physical things, physical illness, it can be social, it can be economical, it can be professional, it can be educational, it can be relational also. So, stress is a normal thing in life, but if the stress continues then it is not normal. You normally, in fact stress is always, we call it eustress. Eustress is very good, without stress you can't perform better. If you want to pass an exam, naturally not anxiety of fear, but the stress of exam is there and you want to do well and therefore you will burn midnight lamps. So, sometimes stress is positive, it is required to go ahead in the life. Physical signs of stress include ulcers, hair loss and insomnia, that is the loss of sleep. Over-dependency, that is the fourth reaction, psychological reaction. Over-dependency is a response characterized by feelings of helplessness. When you think you can't do your work, you are afraid. Some sort of something happens in your mind that you cannot work yourself independently, you require some sort of dependence. So, over-dependency is a response characterized by feelings of helplessness while trying to search for help and understanding to an extent beyond what is considered normal. While healthy people may show some degree of dependence on others during illness, this dependence often increases to the point of being harmful to the patient. The over-dependent patient may be fearful or angry. Fifth is denial, that you just deny that nothing is happening to you, you are all right. By the way, denial is a very, very common defense mechanism initially. You just don't want to agree, and you need some time to cope up with the situation. So, for the time being you just deny that such a thing cannot happen to me, and then your body reaction starts, and later on you may agree with the doctor, yes, some life limiting disease has come to me and I have to face it. It is a psychological anesthetic to an otherwise unbearable reality. It is anesthesia sort of thing, psychological for some time. And like in anesthesia, what happens? Anesthesia is being given just to make that organ dumb, deaf for the period of operation. So, here also sort of patient just for some time, maybe a day, maybe couple of days, maybe a week, just wants to deny it and come back to the original situation where he can face the truth boldly. The psychological shock broker that allows us to suppress mentally what we cannot accept emotionally. I already explained to you, and the picture shows everything about denial. The boy just closes his eyes, puts the palm forward and just says, no, I don't accept it, I don't accept it, And later on he realizes and comes back to the normal situation. Collusion. Collusion implies information, and this information about diagnosis, prognosis and medical details about patient being withheld by some and not shared with significant stakeholders. Now, collusion, what happens that after proper diagnosis, doctors come to know that the patient is going to survive for a very limited time. It is a life limiting disease. We may take curative actions, but after all the end is nearer. So, in such a situation, it talks to the relatives, and relatives now they say, no, don't tell this information, don't give away this information to my parents or somebody, very close, otherwise he will have a shock, he will have a heart attack, he may not survive. In such a situation, doctor and the relatives, close relatives, they collude with each other, and for some time they hide the information. But let me tell you that couple of things about it. Firstly, it is the duty, it is a legal as well as the moral duty of the doctor not to hide information from the patient. Doctor is supposed to break the news very gently, that what is actually the diagnosis of the patient. Secondly, even the relatives also must know, after all, that in heart of heart the patient knows that what has happened to him or her. They know the conditions that this is going to happen, and slowly in a matter of few hours or few days they accept the situation. So, the collusion is not a good place, even a good thing. Even if a individual is very weak, it is better to inform the truth to the people concerned, maybe immediately, but with gentle. That is what we call breaking bad news in palliative care. Anger. This is a very short term reaction to diagnosis of serious illness, and anger is normal thing. I mean, so we get angry, it is a socially also, whenever you interact with each other, it happens when something unpleasant, something what you do not like is being discussed, and people do what you do not like, people just react with anger. Okay, no, this is a very short term reaction, and after that they realize, no, anger was not required. The particular situation could have been tackled with cool mind. So, when a bad news is being disclosed to the concerned patient and it is a serious illness, so naturally the patient gets angry. Actually not getting angry with the doctor, He is not getting angry with the medical setup. He is getting angry with himself. Why this to me? Why? What has happened? What have I done wrong to me? So, this anger is basically to himself or herself or against the God, not against the system as such. Anger, grief, anger, if displaced or projected on staff. Now, situations we are given out in the first column. If you get angry with the staff, alienation, staff will get away from you. They will not be willing to help you in this particular scenario. If anger is suppressed, if you don't show the anger, it is being suppressed, then patient may become withdrawn, uncooperative or depressed. If patient does not show the anger, then the patient will not give you the correct information, will not be able to diagnose properly. So, here let him get angry for a short time, and when he cools down, calms down, he will come back, this is what happened to me, doctor, and he will talk about the case in details, and we will come to know the patient's situations in easy way and in a fuller manner. If persisted, earlier we just discussed that anger for a short period is okay, fine, but if the anger persists, then what happens? It may stop a patient from making positive adjustment to physical disability. If anger persists to the present situation, the patient will not be able to adjust with the surroundings, with himself also, and his life will become bitter, and he will keep on cursing others, cursing the society, even cursing the God, that why this to me, So, the persistent anger is not good for the patient or for anybody for that matter. Depression, the further steps, the advanced step to anxiety. If anxiety continues and if you do not really control your anxiety, then it may happen that you may slip into depression. Recognizing depression is important because patients have a good response to antidepressant drugs. However, it is often missed because symptoms overlap with appropriate response to terminal illness. A person on depression, the picture is very gives the total summary. A person wants to remain alone, hides from others, generally he looks downwards, puts his hands on his head, and somehow keeps on thinking. That is what a person does in depression. Paranoid state. Patients are unable to accept that they are dying. They may believe that there is a plot to kill them, or they believe that deterioration is caused by treatment. Paranoid. They do not accept the real situation, and when they do not accept, they find out the cause of the present situation from their side, and they blame the whole system as such. They do not accept their fault. What is coming to them, they do not accept. And this may be caused by biochemical disturbances inside the body, cerebral metastasis, cancerous cells in your brain, and other psychological factors that may have happened in the past with the person. Family problems. Serious illness changes family psychodynamics. Within families, there is a conflict between the wish to confide or to protect loved one from distress. This is just one problem, and this problem is basically related with collusion. That is what we said earlier, that the loved ones, they don't want to talk about this illness with the person whom they love so much in the family. Other family problems are also there. If there is a family of 4 or 5 and the only earning member happens to be suffering from such a disease, so naturally they will have financial problems, children will have educational problems. And when such problems arise in the family, the psychodynamics changes, interpersonal relationship changes. So, the one thing we must understand, rather two things we must understand and accept: psychological reactions will take place. Normally it will take place. Nobody is so bold enough that one can say nothing is going to happen to me. At least such people in their heart of heart know that something will happen, but they may not accept on their face values. So, point number one, psychological reactions, whatever we have generally said, starting from fear onwards, that will take place. And second point, which all of us can do, is family is the best support. And particularly in Indian scenario, family is the best support. If family remains together and the loved one helps the patient very nicely, this is what I have seen number of times. Some psychological problems can be prevented by good staff-patient communication in the hospital, staff and patient, nurses and the doctors. Good staff-patient relationship. If communication is good, then automatically the relationship between the patient and the working staff of the clinic or the hospital will always be good. Patients to have some control over management of the illness. Patient, after all, we must give some right. It is a right of the patient whether to be treated or not. Doctors may say anything, he is talking from medical point of view, but after all it is my life. Patient will say, I want to get treated the way you are telling me, and I may not want to. After all, who is the boss? Patient is the boss. And therefore, in management of this illness, the treatment plan, what we call it, strategy, doctors must give in to the wishes of the patient, and then thereafter they must make a full treatment plan. Thank you.